This 63-year-old female patient was referred to us for endodontic treatment of tooth number 14. Patient admitted to me that she had been babying this tooth for the past couple of years, putting garlic on her gum and popping a pimple above the tooth on her gum and what have you. Finally, a couple of weeks ago, tooth started to hurt, and she went and saw her dentist. Her dentist put her on antibiotics and told her that she needed to be seen by an endodontist. So she found us, referred herself to us, and let's take a look at the tooth now. You can see an old amalgam restoration. You can see a periapical lucency there. Let's look at another angulation. And you can see the large periapical lucency that's associated with the palatal root there. And this is another angulation. So we discussed options with the patient. Patient wanted to try to save the tooth, and that's what we did. Before I show you the point of view clinical video of this tooth from start to finish under a Zoomax surgical operating microscope with the integrated 4K camera, let me show you the clinical view. So this is the sinus tract right there. That's the tooth right there. And that's the sinus tract right there. Buccal infiltration using lidocaine 2% with 1 to 100K epi, and then I'm going to also give her a palatal injection as well. Palatal injection. All right, very good. Let's go ahead and put our rubber dam on. No rubber dam, no root canal. All right, rubber dam goes on. Rubber dam clamp first. I'm going to lock it in and rubber dam. Takes about 20 seconds to put the rubber dam on. And patient requested a bite block, so we're going to place a bite block in her mouth. We got 6 hands, 6 hands in there. Rubber dam frame. I only have a few more clinical POV clinical cases left. I only had the Zoomax microscope for a few weeks, so I only have a few more cases left. But the cases that I've covered basically range from, it's covering everything. So my assistant wiped down the tooth with 70% isopropyl alcohol, the tooth and rubber dam clamp and rubber dam around the tooth. So as I was saying, the POV clinical videos that I've posted many of them so far. They cover basically every aspect of endo, from regular root canal to retreatment to MTA placement, MTA plug placement, and what have you. So, all right, so you can see the old amalgam. I'm going to go ahead and get started here. I'm going to go ahead and get started using a end cutting cylindrical diamond burr. As you can see, I don't use water, but I know what I'm doing. I'm not going to be frying the periodontal ligament. We don't care about the pulp tissue. but we do care about the periodontal ligament. So I'm not using water. Please, I'm begging you, you use water. I know how to use my burrs and not fry the periodontal ligament, not heat up the tooth so much so as to fry up the periodontal ligament. But you not having as much experience as I do, I'm begging you, please use water to cool the tooth off. All right, so my assistant is blowing air on my mirror and also the tooth to get rid of the debris. My assistant to the left is suctioning. This is 6-handed endodontics, as you can see. And we are making our endo access. By brushing, I'm not going in straight. Nope. Brush, brush, brush. Take my time. Make my endo access by brushing away the layers of dentin slowly. We're not dealing with a huge pulp chamber here, by the way. You saw it in the pre-op PA. So I'm not going to be expecting my diamond burr to drop into a large pulp chamber. Taking my time, just brushing away the dentin. Brushing away the dentin. Let's go ahead and switch to ultrasonics now. And this is my Ultramint Pro ultrasonic unit, manufactured by 8 Teeth. I have a scaler tip right now attached to it. And I have filled the container of the ultrasonic unit with 2% hypo. So I'm just cleaning the pulp chamber walls right now and the floor of the pulp chamber. Getting rid of all the debris. And there were a few pulp stones that I'm ultrasonically removing, irrigating out. Again, my assistant dried the tooth, the pulp chamber, so I can see. Now I switch to 6% hypo, and again, I'm irrigating. Remember, the solution to pollution is what? Dilution. All right. So let's see what we got here. I think I have the palatal here that I'm trying to see if I can instrument it. Just open up the coronal part of it, and I did. Okay, this is my reciprocating handpiece, M4 safety handpiece. Right now, I'm in the MB1 canal, and I'm running my 08C file in the MB1 canal. The handpiece is running at 1000 RPM with the torque off, and I just instrumented pretty much to working length the MB1 canal. Now I'm feeling around trying to see if I can find any other canals with this 08C file. As you can see, I'm brushing away, activating the 6% hypo, because that's what this handpiece does. You're not only instrumenting with it, but when you run it at 1000 RPM, you're instrumenting and shaping the canals with it, but you're also activating the 6% hypo sonically. As the file that's attached to the handpiece reciprocates at 1000 RPM, it also acts as a sonic activator. So you're not only instrumenting and shaping the canals, you're also activating the 6% sodium hypochlorite within the canals. All right, now again, I'm using my 08C file attached to this reciprocating handpiece that I'm running at 1000 RPM with the torque off, which means basically no torque here. I don't want any torque activation. The torque will want to turn the file back out, right? That's what the torque does. This is a reciprocating handpiece. Why would I want to have the torque on? I wanted the handpiece to reciprocate. All right, I'm trying to feel the MB2 right now to see if I can get inside of the MB2 canal. That's why I don't have much hypo in the pulp chamber, because I want to be able to see. And I got a catch, definitely a catch there. Can you imagine not having that reciprocating handpiece? I would have I used to use my fingers and watch wind. Now this does it for me at 1000 RPM. So it basically does this at 1000 RPM, the watch winding of the file. Now this does it at 1000 RPM. I'm getting a catch where I believe the MB2 is. Okay. Remember what I talk about? Sometimes the orifice of the MB2 is under a dentinal bridge. That's the case here. So there's a little lip right over the orifice of the MB2 canal. Right now, I'm using a thinner end cutting diamond burr, and I'm just removing that dentinal bridge. Trying to open up the orifice, expose the orifice of the MB2 canal. Right now, I'm using my 10C file attached to my reciprocating handpiece. And take a look here. I'm inside of the MB2 right now with the 10C file. Again, I'm not using hypo. The canal, the pulp chamber is not filled with hypo right now because I want to be able to see. And right there, I'm inside of the MB2 canal right now with my 10C file that I'm running in my reciprocating handpiece at 1000 RPM and torque off. All right, so let's go ahead and clean it up a little bit more with the ultrasonic. Just get rid of that dentinal bridge. Open things up a little bit more. As you can see, I'm troughing along the mesial wall of the tooth. Along the mesial wall. Just removing that dentinal bridge that seems to be blocking the orifice of the MB2 canal. And I'm running this tip away from the furcation, as you can see. More towards the mesial. Not being too aggressive with it. As you can see, just removing little layers of dentin. You can see I already have the palatal and the distal buccal. I found the MB1 as well, and I instrumented it to radiographic working length. I'm just right now trying to get into the MB2. And again, this is my C file, 08 C file, and I'm trying to see if I can get it into the MB2 right now. The pulp chamber is dry because I want to be able to see. I can see a dot that is representative of the orifice of the MB2 canal. So I don't want to lose that dot. If I fill the pulp chamber with hypo, I would have lost my visual to the orifice of the MB2 canal. As you can see right there, that's the MB2 that I'm trying to get into with my 08C file. Can you imagine if I didn't have a C file? Regular 08 is pretty soft, so it would have bent right away. The C file gives me some stiffness, so I can actually put some force on it, apical force on it, without it bending under pressure, under force, buckling under force. All right, then I realized I still need to clean up that dentinal bridge more. I need to expose more of that MB2 orifice. So again, I'm using my Ultramin Pro ultrasonic unit, and I'm using a scalar tip right now. The Ultramin Pro ultrasonic unit is very versatile. You can do endo with it. It has an endo setting, it has a perio setting, and it also has a restorative setting. And of course, the container that you can fill with your irrigant of choice. You can fill it with saline, you can fill it with chlorhexidine, you can fill it with hypo. Okay, let's irrigate it with 6% hypo. Copious irrigation with 6% hypo to get rid of all the debris that were formed by me using the ultrasonic device. Copious amounts of 6% hypo will be used throughout the procedure. You can already see the orifice of the MB1, distal buccal and palatal there. And I'm still working on the MB2. All right, let's go back in with the 08C file again, attached to my M4 safety handpiece, which is a reciprocating handpiece that I'm running at 1000 RPM and torque off. And let's see if we can open up that MB2. Remember, this was a necrotic tooth with periapical relucencies. I cannot afford not to instrument the MB2. I must find a way to instrument every single canal that this tooth has to be able to remove all the necrotic infected pulp tissue, plus of course bacteria and their toxins. That's the goal. So there is no, oh, I couldn't open the MB2. I must open the MB2. So if you're a general dentist and you can't get to these canals, open them up, please refer the patient to an endodontist. All right, so you can see the MB1, distal buccal, palatal, and I'm still working on the MB2. Taking my time, working on the MB2. Irrigate again with 6% hypo. This is the upper left first molar, by the way, so get your orientation squared away. All right, let's switch to 10C file and let's try to go to working length for now. Sometimes when I can't get a canal open, I'm gonna start focusing on the remainder of the canals. And then when I have the pulp chamber filled with hypo, sometimes this acting of irrigation with 6% hypo and instrumentation of the canals allows the hypo to kind of soak into the canal that I couldn't open. And sometimes I go back and lo and behold, the canal is open now. All right. So I'm using my 10C file right now in my reciprocating handpiece that I'm running at 1000 RPM with the torque off. And lo and behold, there you go. I'm in the MB2 canal. See what I mean? With my 10C file, right now I'm instrumenting the MB2. The MB2 that I couldn't get to with an 08C file. I just left some hypo in there while I was working on the other canals. And now suddenly the MB2 is open. So again, copious irrigation with 6% hypo. Very good. All right, let's use the microsuction and inspect everything. I want to make sure that we don't have any more canals. Looking for a MB3 or DB2 or P2. So right now is a good time to inspect things. I mean, I'll be inspecting throughout the procedure, but right now in the beginning, my eyes are fresh. So let's go ahead and see if we got something else going on. Again, right now, I'm using my Ultramint Pro, different ultrasonic tip. And again, trying to see if I can get a better access to this MB2 canal. Just clean things up a little bit more. Obsessive compulsive disorder. That's definitely me. All right, right now, let's go ahead and get our working lengths. I'm using the FinePEX apex locator manufactured by 8 Teeth. So let's go ahead and get our working lengths. And you know this step. so I really don't have to go over it with you. I got a reference point for each canal, and this is a 31 millimeter file that I'm using because the estimated working lengths were 22, 23, 24 millimeters. So I'm using a 31 millimeter 10 file. And let's see what these working lengths are. Let's go ahead to the DB and do the same, and then I'll do the palatal and the MB2. And it turned out that MB1, DB, and palatal were 22 millimeters, and MB2 turned out to be 24 millimeters. Of course, because turned out to be 24 millimeters because of the reference point. Okay. Very good. So let's fast forward a little bit. I got my working lengths. So let's go ahead and start instrumenting. I switched to 25 millimeter files now because my working lengths turned out to be all 22 except the MB2 that turned out to be 24. So I'm using a 25 millimeter number 10C file measured to 22 millimeters. I'm running the handpiece. It's a reciprocating handpiece. I'm running it at 1000 RPM with the torque off, and I'm going to our working lengths that we just determined using the FinePEX apex locator manufactured by 8 Teeth. As I said, the great thing about this reciprocating handpiece is that when you run it at 1000 RPM with the torque off, you're not only instrumenting and shaping the canals with the files that are attached to it, but you're also sonically activating the 6% hypo within the canals and the pulp chamber. Sonic activation. I'm in the DB right now. And you can see I'm brushing up and down, brush, 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 up and down, away from the danger zone, which is the middle of the tooth in this case, the center of the tooth. I'm brushing away from the center of the tooth towards the appropriate line angles. And as you can see, my 10C file is going to our working lengths perfectly. Up and down, brushing motion, creating a glide path for the NiTi files that we'll be using next. Up and down, brushing motion, activating the 6% hypo, and also instrumenting and shaping the canals. All right, let's go ahead and use the microsuction. Again, do our inspection. I'm trying to remeasure our working lengths again. What is that saying? Measure twice, cut once. You want to make sure that your working lengths are dead on. You don't want to under instrument. You don't want to instrument out of the canals, over. So measure a few times throughout the procedure, just to make sure that your working lengths are good. So let's fast forward. Irrigating again with 6% hypo, now that we got our confirmation, again with the measurement of the working lengths. All right, I'm using a 12C file right now, and I'm trying to get into that MB2 canal with the 12C file that I'm running in my reciprocating handpiece at 1000 RPM with the torque off. I swear, I say that so many times, 1000 RPM with the torque off, and read the comments. There's always one or two people who say, Doug, what handpiece is this? That's one question that they asked me. And the other question they asked me, what's the RPM and the torque settings? I'm like, my goodness, did you even watch the video or watch little fragments of the video? Some of you guys, I swear, you're hilarious. I just don't know how to respond to some of those comments. All right. Number 12 C file. Right now, I'm in the palatal canal, 22 millimeters from the reference point. Again, you can see that I'm pushing apically and also brushing as I'm moving the file out of the canal. See that? Up and down, up and down, up and down, up and down. There you go. I'm pre-bending the file. All right. I'm in the MB1 canal right now with the 12C file that I'm running in this reciprocating handpiece at 1000 RPM, torque off. The great thing about this handpiece is that it not only instruments and shapes the canals, it also activates the hyposonically within the canal system. All right. So as you can see, MB1, I can go perfectly to my working length. When you remove the file, make sure you always inspect the file. I always do that. And my assistant also does that too. As soon as we see a little change in the formation of the metal, unwinding or a little shiny spot that sometimes forms on the metal before the file fractures, we catch that. All right. Let's irrigate the heck out of this tooth with 6% hypo again. I'm in the palatal canal right now. Constant irrigation with 6% hypo. All right. Just instrumenting the canals. Right now I'm running the 10C file again, just to make sure that I'm not losing my patency. Achieving and maintaining patency is extremely crucial, especially in cases where you're dealing with an abscess tooth, infected, meaning that the pulp tissue was necrotic and infected, and there were periapical relucencies. Achieving and maintaining patency throughout the procedure. That's why recapitulation is so important in between files. Irrigation and recapitulation, just to make sure that you've maintained patency. You don't want to block the canals with the debris that these files produce, or block the canal or canals with necrotic tissue. You don't want to do that. So as you can see, right now, up and down, activating the 6% hypo and recapitulating about 0.5 millimeter to 1 millimeter more so than the working length of the canals, just to make sure that the patency is intact. All right, let's go ahead and irrigate again with 6% hypo. All right, 12C file, back in the MB1 again, to our working length, MB1, 12C file, up and down, brushing motion away from the center of the tooth. Irrigate again with 6% hypo. Copious amounts of 6% hypo used throughout the procedure. Constant sonic activation. All right, let's go ahead and go to number 15C file right now that I'm running in my reciprocating handpiece at 1000 RPM with the torque off. Number 15C file right now in the MB1 canal, up and down, brushing motion, instrument shape the canals, and also activate the 6% hyposonically. When you brush, you're in control of the taper of the canals. So I can literally finish a root canal with just the number 15C file. Just taper it to my liking, 5%, 6%, 7%, because that's what brushing does. All right. Right now, I'm in the MB2 canal, right there. MB2, up and down, brushing motion, up and down. Instrument, shape the canals, taper to your liking while you're brushing, and also sonically activating the 6% hypo. All right. Irrigate with 6% hypo again. Get rid of all the debris, pulp, necrotic pulp tissue or what have you that you have. Just irrigate all that stuff out. Get rid of all the bacterial biofilm and toxins. That's the goal of endodontics. Copious irrigation. Solution to pollution is dilution. All right, let's go ahead and see if we can use our number 20 flare file. This is a stainless steel K file with a 5% taper. And right now I'm using a 21 millimeter. There's a stopper on it, which means that it's going to 20 millimeters. The working lengths were 22 millimeters. And I'm brushing the canals with this. Up and down, and brushing motion away from the center of the tooth towards the appropriate proper line angles. All right, I'm in the MB2 canal right now, again creating a taper with this 5% taper stainless steel file attached to my reciprocating handpiece that I'm running at 1000 RPM and torque off. I'm in the DB right now, DB canal. I'm not forcing the file. I'm allowing it to go where it wants to go. I already used 08, 10, 12, 15 C files to my working lengths while I brushed with them. And now this 5% stainless steel file created even more taper. This is all I could just finish with these stainless steel files. I could just finish the case with these files. I really don't need to use NiTi files. I can just finish. I'm pretty much almost done anyways. So that's was one of the reasons why I stopped using NiTi files to begin with. Why use NiTi files when I can just finish a case with stainless steel files, right? All right, so number 15 C file, that I was in the MB1 canal. Just making sure that I can go to my working lengths and a little bit, maybe a little bit beyond, just a little bit with the 15. I don't want to go too far with the 15. I don't recommend recapitulating with a number 15 file. All right, again, irrigation copiously with 6% hypo. Constant irrigation. And in my case, as I'm using the reciprocating handpiece, sonic activation of the 6% hypo happens at the same time as I'm instrumenting and shaping the canals. So people ask me, what is your secret to getting all these lateral canals? It all starts with irrigation. Right now, I'm using these files. Easy shaper files. All right. Easy shaper files. The first file, and I measured it to 22 millimeters, of course, the working length. These are great files for these calcified canals. Again, up and down, and brushing motion with these files. This is the easy one. Again, copious irrigation with 6% hypo. You can go to flexivodental.com to purchase these files. You can also reach out to the representative. He's pretty active on various platforms, especially on Instagram. His Instagram tag is flexivodental on Instagram. All right. Next, again, I'm using the easy shaper file right now. These files. Very careful. I'm not forcing the file. Remember, I created a very good glide path all the way to working length of each canal. Again, copious irrigation with 6% hypo. Pay attention to how I'm using the 6% hypo with irrigation needle and syringe. I don't let it bind to canal walls, up and down, up and down, up and down. Don't let it bind. Minimal digital pressure on the plunger of the syringe. And of course, make sure 100% that you use a side venting irrigation needle. Side vented irrigation needle, all right? All right, back in the MB2, with my 10C file that I'm running at 1000 RPM with the torque off. Brush, brush, brush. All right, irrigate, irrigate, irrigate. Again, back into the MB2. Perfect. Brush, brush, brush. Number 10 C file. I'm not only instrumenting and shaping the MB2 canal right now with this file, 10C file, I'm also activating the hypo, 6% hypo sonically. Irrigate copiously with 6% hypo. All the canals, as you can see, the irrigation needle penetrates into the canals. I don't let it bind to canal walls. Up and down, minimal pressure on the plunger. And let's go ahead and inspect one more time, remove the hypo using my microsuction. And let's inspect the tooth again, just to make sure that I'm not missing any anatomy. You can see MB1, MB2 right there. Distal buccal and palatal there. Perfect. I'm going to remeasure MB2 one more time. And again, MB2 turned out to be 24 millimeters because my reference point was the mesiobuccal cusp. So it turned out to be about 2 millimeters larger as the file wants to tilt towards the buccal, the mesiobuccal cusp. So it increased the working length of the MB2 to 24, 2 millimeters more than the MB1 canal. I'm using a Finepex apex locator manufactured by A-Teeth here. Measure twice, cut once. In my case, measure 5 times, cut once. All right, let's fast forward. As you can see, we're not rushing anything. There's no rushing. So I'm using my number 10 C file, and I'm going to 24 millimeters. Remember the MB2 working length turned out to be 24. All the other canals were 22 millimeters. And again, it was because of my reference point being on the mesiobuccal cusp. Again, irrigate with 6% hypo. You can see the MB1, MB2. All right, let's go to number 15 C file now. 24 millimeters. We're instrumenting the MB2 canal right now. We pretty much are done with the other canals. This MB2 canal, I had to give it a little bit time, a little bit soaking time with 6% hypo. So I left the instrumentation of the MB2 canal, the actual real instrumentation shaping of the MB2 canal, to the last while I instrumented and shaped the other canals. Again, copious irrigation with 6% hypo. You can see the MB1, MB2 right there. You can see the palatal. You can see the distal buccal. All right, let's go ahead and put a flare file in the MB2. Again, I'm using a 21 millimeter flare file, stainless steel flare file. It's got a 5%. I'm in the MB2 canal. I'm shaping, instrumenting, shaping the MB2 canal right now. Up and down, brushing motion away from the center of the tooth. You saw the debris in the flutes of the flare file. That's what you want to see. Excellent. Irrigate again with 6% hypo. MB1, MB2, distal buccal, and palatal. All right, let's go ahead and go to our, again, easy shaper files. I'm using the easy one right now. Again, copious irrigation with 6% hypo. All right, let's go ahead and go to the next file. All right, MB2, 24 millimeters from reference point is the mesiobuccal cusp of the tooth. Did you see all the debris? That's all infected, contaminated dentin that we are removing. These bacteria and bacterial biofilm penetrate deep within the dentinal tubules of the canals, so you want to shave off the dentin from the walls of the canals because that dentin is infected, contaminated with necrotic pulp tissue and bacteria and bacterial toxins. All right, very good. So cone fit time. I make my own master gutta-percha cones, up and down, up and down. I'm also activating, as you can see, up and down, up and down, up and down again. I'm using a standard regular 20, number 20, 4% gutta-percha cone, and I let it go as far as it wants to go and then measure to my reference point. And if it's more than 22 millimeters, I cut whatever's more than 22 millimeters. Remember, my working length was 22 millimeters. All the canals, the MB2 was 24 millimeters. So up and down, activate the 6% hypo, measure to reference point to see what the measurement is. Let's say the measurement says right now the gutta-percha went 26 millimeters. Well, my working length for the MB1, let's say, I'm giving you MB1 as an example. The gutta-percha number 20 went to 24 millimeters. My working length was 22 millimeters, so I cut 2 millimeters from the tip of the gutta-percha. So this is how I make my own master gutta-percha cones. Okay, so I got the MB1. I'm measuring MB2. My MB2 working length was 24 millimeters. Let's say this gutta-percha went to 25. That means that I need to cut 1 millimeter from the tip of this number 24% gutta-percha cone, and it'll be my master gutta-percha cone for the MB2. So this is how I do it. All right, let's go to the next file. All right. Instrument. All right, very good. Irrigate again with 6% hypo. Copious irrigation with 6% hypo, as you can see. Okay, let's try the MB2 again. There you go. It should go to 24 millimeters. Again, if it goes in more than 24 millimeters, then let's say it goes to 25. Then I cut 1 millimeter from the tip of the gutta-percha cone. That'll be the master gutta-percha cone for that canal, for the MB2, for example. All right, so I realized that I need to work on the MB2 a little bit more because my gutta-percha cones were coming out and the tip of the gutta-percha cone was kind of bent a little bit. I didn't like that. So I'm just opening up the MB2 a little bit more. Just opening it up a little bit more. Sometimes I switch between these two files, the Easy Shaper file and the Super Flexi Gold. I kind of go back and forth sometimes. So you can also purchase the Super Flexi Gold from Flexivo Dental. These are great files. I haven't had a single case, and I've been working with them for a long time. I haven't had a single breakage. But then again, you can see that how much emphasis I put on my glide path to working length before I put a night-eye file in the canals. All right, now let's see how we're doing with the MB2. Should go to 24. Again, if it's longer, if it's going longer, let's say it goes to 25. Then I cut 1 millimeter. The working length for the MB2 was 24 millimeters. The rest of the canals were 22 millimeters. Remember that. Anyways, this is how I make my master gutta-percha cone. You do what works for you, okay? You can just do whatever works for you. Sometimes they have matching gutta-percha cone with the night-eye file, the last night-eye file that you use. Whatever works for you, brother or sister. All right, this is how I do it. You're not married to my methods and my style. You're watching my videos just to get an idea to see how an endodontist with 24 years of experience does his root canals. Just get some ideas and then make modifications. As long as you, of course, adhere to the fundamentals of endodontics, then you can develop your own sequence of filing. Again, as long as you adhere to the fundamentals of endodontics. You don't have to do things exactly as I do them. All right. So anyways, final rinse with 70% isopropyl alcohol. This is 70% isopropyl alcohol. Okay. So I got all my working master gutta-percha cones to appropriate proper working length for each canal, and final irrigation with 70% isopropyl alcohol. I'm using my microsuction to suction out the 70% isopropyl alcohol right now. All right, very good. That was distal buccal. That's palatal, MB1, MB1, MB2. All right, just getting all the liquid out of there. And take a look how beautiful everything looks, how nice and clean everything looks. Palatal, MB1, MB2. Look at that. Beautiful, beautiful. And of course, distal buccal you saw. All right, sterile paper points to further dry the canals. These are sterile. They come sterile in small packages, I believe, 6 or 7 of these sterile paper points. MB2, let's dry the MB2. And again, I not only dry the canals, I also inspect in situations like this. Inspect the tip of the paper point, just to make sure, because if there is wetness, if there is drainage, if there's oozing that doesn't stop, I'm not going to complete the root canal. I'm not going to obturate while the canal or canals are oozing. I'm going to place calcium hydroxide in the canals, pack the canals with dense calcium hydroxide all the way to working length of each canal, and then I'm going to temporize the tooth and bring the patient back in a week. Then I will then remove the calcium hydroxide from the canals, irrigate everything out using 6% hypo again, and then complete, and then again inspect to make sure that the drainage has stopped, the wetness has stopped, the oozing has stopped, and then again I go ahead and irrigate and obturate. Let's say second appointment comes and I check and the canal is still oozing. Well, I'm not going to obturate. I'm going to put more calcium hydroxide and temporize the tooth and bring the patient back, okay? But in cases like this, where the canal is dry, I can go ahead and obturate. Even though you saw that there was a sinus tract on the buccal aspect of this tooth. But because the canals were dry and I checked with sterile paper points that I took to appropriate working length for each canal, inspected sterile paper point, and they all came out dry, that means that I can go ahead and obturate and complete the endodontic treatment. All right, so MB1, MB2, this is a modified warm vertical obturation technique. I'm using a number 2 Buchanan plugger. So I place the master gutta percha cones in the canals, and then I use the System B heating unit, remove the coronal part of the master gutta percha cones, and thermoplasticize the remainder of the gutta percha within the canals. And then I use my number 2 Buchanan plugger, which is a night-eye plugger, and I condensed the thermoplasticized gutta percha. This is the stobuccal right now. Again, using the Buchanan Buchanan heating unit. System B, B stands for Buchanan, by the way, if you didn't know. Remove the gutta percha from the coronal and thermoplasticize the rest of the gutta percha, and then use the number 2 Buchanan plugger to condense the thermoplasticized gutta percha. This is how you obturate the lateral canals and complexities. But it all starts with copious irrigation with 6% hypo and sonic or ultrasonic activation. Now let's go ahead and obturate the palatal canal. Master gutta percha dipped in AH plus sealer goes to working length. Very good. I'm going to use the System B to remove the coronal part of the gutta percha and then thermoplasticize the rest of the gutta percha within the canal. This is my assistant removing the gutta percha that I cut, thermoplasticize the remainder of the gutta percha, and then I use my number 2 Buchanan plugger, apply apical pressure, hold it for a few seconds. Perfect. Very good. Next, I'm going to use my Obtura gun, Obtura 3 Max Obtura gun, and I'm going to fill the rest of the canals with the thermoplasticized gutta percha, the molten gutta percha. And then I'm going to use my Buchanan plugger, and I'm going to condense the gutta percha. Once I do all of that, then I'm going to go ahead and use isopropyl alcohols, soaked cotton pellet, and remove the sealer from the pulp chamber floor and pulp chamber walls. Make sure everything is nice and clean. And then sterile sponge goes in, followed by cavit. And we're done. We're going to clean the patient up, take some post-op radiographs, and go over some post-op instructions with the patient and emphasize to the patient how important it is for her to go back to her dentist for the permanent restoration. All right. Very good. That was MB2 right there. Let's go ahead. There you go. Palatal right now. This buccal. Make sure the gutta percha is condensed. Sometimes I get little tiny gaps here and there between layers of gutta percha, and it's okay. It's all right. It's one of the consequences of warm vertical obturation technique. It's okay. Little gap here and there doesn't have a negative effect on the outcome. All right, very good. So let's go ahead and clean up the pulp chamber with 70% isopropyl alcohol. There you go. Get all the extra sealer and what have you, gutta percha out of there. Excellent. Very good. I'm going to dry a little air. Make sure the pulp chamber is nice and dry. All right. Sterile sponge goes in and cavit follows. And that's it. Okay, so let's go ahead and we're going to, of course, clean her up, and the girls will be taking post-op radiographs. All right, so cavit goes in. Very good. And let's go ahead and look at some of the post-op radiographs. Remember, this is what we started with. You can see the buccal sinus tract right there. Here's the post-op. So you can see MB1, MB2. Look at that beautiful curvature of the MB root. Distal buccal and palatal right there. You can see everything went beautifully. Another angulation. Another angulation. Another angulation. Another angulation. Okay, so that's it. I hope you enjoyed watching this video and learn from it. Make sure you have subscribed. Make sure you press that like button. Make sure you make a comment. Tell your friends. And follow the fundamentals of endodontics. No rubber dam, no root canal, 6% hypo, copious irrigation, sonic or ultrasonic or both. Activation of 6% hypo. Make sure the canals are dry. Check your working lengths multiple times. Instrument to working lengths. Recapitulate. It's all about irrigation activation of 6% hypo. So, very good. See you guys in the next video. Bye-bye.